Today we're going to talk about breast augmentation, which is the most requested procedure in our practice. So today we have here natural breast implants. So there are really two different types of implant fills. There is gel implants, silicone implants, and saline implants. In our practice, about 95% of the implants used are gel implants, and here we have examples of the three different types of gels. We have the standard, kind of the middle ground gel, and we have the more cohesive gel. This is what we refer to as the gummy bear gel. So when you see the more standard, the way you can tell the difference is when you hold it up and you see the example here, the rippling, which is natural and not very noticeable in the body, but a little bit more so than when you go up on the more cohesive gels, which you see here. And then finally the gummy bear, which is going to have the least amount of rippling. So you can see here that there are different types of shapes. For any given size of an implant, you can change the shape of the diameter of the implant as well as the projection of the implant. So patients, you can see here for the same size, you have a more narrow diameter and a more projecting implant, and here you have a flatter, larger diameter implant with less projection, and it really depends on what shape and contour the patient is looking for as well as the size relative to their body frame. So in general, we're seeing a lot more of the more full type. This is a full implant where you're seeing more narrow bases with more projection. There's really three different incisions in breast augmentation. You have an incision that can be in the armpit, an incision that can be around the nipple, and an incision that can go in the inframammary crease or the crease of the breast. The majority of implants done today are done underneath the breast. This incision hides well in the natural crease and also allows for the best placement of an implant. The other option really is the axillary incision. However, that one tends to be associated with a little bit higher riding implants and a little bit less of a natural look. Breast augmentation typically takes about 1 hour in the operating room. Patients in general are back off of pain medications about 72 hours after the procedure. It is natural for implants to sit up a little high on the chest wall initially, and about over 3 months they come down into a more natural position. Patients typically note that they're not able to exercise to their fullest until about 6 weeks after procedure. However, in general, people are starting to do light exercising, any exercise that limits the amount of muscle use, pectoralis muscle use, at about 2 weeks. And in general, patients are back to the regular life 1 week after surgery. Most patients choose silicone implants mainly for their more natural feel and texture in the body and a lower rate of rippling. So that's the main reason why patients choose silicone over saline. This is an example of a textured implant. As you can see, the surface has got a texturing to it versus a smooth implant. You can also see that this is a shaped implant, meaning that it has a natural breast-like shape to it. This is more often used in our reconstructive patients where we need to reproduce the shape of a breast, while in a general breast augmentation we can take advantage of the natural breast form that's already there and just augment it. The texturing of an implant really allows it to stay in a more stable position, which is critical for a shaped implant, because if a shaped implant shifts, it really shifts the shape of a breast. When a smooth implant, round implant, that's not as much of a big deal because when it's in the same, when it rotates, there's no difference in the shape. There's really three ways of placing an implant. There is over the muscle, under the muscle, and partially under the muscle and partially under the breast tissue. The majority of the time we do the latter, which is called a dual plane augmentation. It gives a more natural look. We place under the muscle because the muscle provides an extra layer to hide any implant shape, and it also provides a reduced risk of capsular contraction. So in our practice, we have our patients come in for a consultation where we discuss all the options that they can pick from, and then at the end of the consultation they can try on sizes. The patient really can elect what size they feel looks best in a mirror. However, there are certain limitations to how big a patient can go, and that's depending on their natural body shape and breast shape. The shape of the breast and the size of the breast, the platform of the breast really determines how big you can go, and we make that decision together in consultation.